All right, so in the previous video, I got a little ahead of myself. Want to make sure, so I'm going to still post that other video. That other video's got fantastic information for you. But now what I'm going to do is I'm going to have everything set up and ready to roll. The thing that I failed to do was before I try to pull it, well, you want to make sure that you deflate the cuff. The cuff's absolutely got to be deflated. So what we're going to do is go ahead and attach that. And now I'm going to work this loose again. And again, if the adhesive bandages have, or the adhesive pads have, if they have any, if they're super sticky, then what we'll do is you can take a wet gauze and work those loose. But now that those are loose, you can leave everything connected. I'm going to let the ventilator fire a breath. And I'll place the ventilator in standby. Yes, I do want to go in standby. Deflate, pull, cough. After the tube's out, they're coughing. I'm going right in, suctioning their secretions out. And now that I've got that bagged up or covered up, that way it's not making a mess on them. They've coughed. I've cleared their secretions. If they've got any more cough, take a nice deep breath. Place the supplemental oxygen in their nose. Have them take a deep breath. Then you're going to assess their breath sounds. Listen over the throat, make sure that they don't have any stridor. Have them cough and clear. They've already done that for you a couple of times. Ventilator, most of the time in the hospital, I'll leave the circuit and the vent in there for a little bit just to make sure they're going to do all right, because we'll probably check a blood gas here in about an hour to assess how they're doing afterward. And again, we've listened here to make sure there was no post-extubation airway edema. And then now that you've got everything wrapped up in your chuck, you can just toss that in the trash can. And then this is available in the event they've got to cough anything up again. So have them deep breathe, and you can tell them that their throat or their voice may seem a little hoarse in the future. So just kind of take it easy. And then, depending upon what their dietary plan and stuff is, whether or not they can go to like having ice chips or anything like that. But you probably wouldn't want to try to immediately swallow liquid after the extubation procedure. Assess your patient, heart rate, blood pressure, SpO2, and then we're going to check a blood gas in about an hour post-extubation to make sure everything's going all right. And that's it.